treatments of patients, especially of those with long-term conditions such as diabetes or respiratory disease or cardiovascular disease, needs to take into account their kind of history and their current medication. So DECIPHER will allow a patient to provide access to that information to the clinician when they're being treated. The need for DECIPHER has arisen because of the greater mobilisation of patients around Europe and the rest of the world. We're looking at Europe in the first instance, but the idea is that when a patient travels from one country to another, they can take elements of their personal health records such that they can receive better treatment when they go to that foreign country. DECIPHER will enable you, if you're a patient, to actually present the data about your current clinical condition, your current medication, and you can do that via a mobile interface to the actual clinician who's treating you. If you're a clinician, the benefit of DECIPHER will be that you will be able to get access to a patient's data when they turn up in your GP surgery or when they turn up in your A&E department. DECIPHER is anticipated will provide continuity of care, such that if you turn up in a foreign country and you've lost your medication or something happens to you in an emergency, the clinician will be able to access elements of your personal health record via the mobile interface that DECIPHER gives, so to improve the quality and the continuity of care that you receive. Likewise, again for the clinician, it's much easier to find out about you, what's wrong with you, what you're currently on, and that just leads to improved quality of care. Okay, so let's say you have an asthma attack or you go into a diabetic coma and there's no one around to actually tell the clinician what your current history or medication is. The clinician will be able to access elements of your personal health record to treat you much more effectively. Apart from the benefit to the patient, there is obviously a benefit to the healthcare provider. They can treat you much more quickly, much more effectively, and that will obviously provide cost savings to that healthcare provider. The two other things that DECIPHER will do. The first is it'll actually provide prompts and reminders to patients so they can actually manage their conditions better. It will incentivise them to actually take better care of themselves. And secondly, for the healthcare providers, it provides them with a bank of information about not only individual patients, but can also provide them with information about groups of patients, which they can actually actively seek out what's going on, what's working, what's not working. We're asking organisations and companies to work together to actually develop the system. It's anticipated that either the patient will provide access to just certain elements of their personal health record, or actually create their personal health record, and that will then be provided via a confidential process to the clinician. EU healthcare organisations are communicating about patients, but mainly on a national or just a regional basis. They're not doing it across the boundaries of Europe, and that's where DECIPHER is trying to work to bring those different systems together, and not necessarily to create one super system, but to actually interface with individual systems.